Welcome to the Doctors Making a Difference podcast. Doctors change lives every day, but what happens when life changes yours? A single injury, a sudden illness, your career, your income, your future can shift in an instant. The best physicians don't just plan for success, they protect it. At Set for Life Insurance, they believe financial security isn't a luxury, it's a necessity. True own occupation disability insurance ensures that no matter what happens, your future stays in your hands. Because protecting your income means protecting everything you've built. Visit drpodcastnetwork.co/set for life today. Secure your future before life makes the choice for you. Have you ever wondered what you can do as a physician in the regulatory environment that we live in? Lots of people think about telemedicine and expanding beyond their natural reach and beyond the things they're naturally doing in their specialty, but they don't know where to turn. Today, we get the chance to talk to Phoebe Gutierrez, who is a co-host of Telemedicine Talks, a podcast, one of our sister podcasts on the Doctor Podcast Network. Very excited to welcome Phoebe today. Tell our audience about yourself.
Yeah, totally, totally. Well, thanks, for having me, Peter. It's great to get to kind of meet you in our little, podcast community also. Um, my background is, heavily in compliance and regulatory affairs. I was an ex-regulator for the state of California for about 10 years or so. And really got to kind of understand the framework of how to really interpret regulations and how to build frameworks around how to operationalize them and then ultimately like protect yourself as a physician so you're not in trouble. And then also just how confusing everything is. So I've kind of gotten to learn to speak that language and I'm able to translate it to doctors that I consult for.
That's great. Well, and when we talk about the regulatory environment, it's a moving target. And I just want to kind of express at the beginning, when I've thought about telemedicine or branching out and doing other things, that is the first thing that comes to my mind. Is this legal? Can I do this? Am I going to get sued for this? And many times I think that we're busy in the middle of our careers and you ask somebody in your administration, like, oh, how do we do this? And a lot of times they don't know either. Like, well, the regulatory situation is changing. So you and your co-host have been able to highlight this regulatory background and then just kind of empower doctors to be able to do more than they're currently doing or expand into spaces they haven't been. And I'd like to hear the genesis of how that started, how you and your co-host began this process.
Yeah, so it's kind of funny. I think that COVID was really kind of like a pivotal moment for like many physicians and even like people in my space. Like that was when I decided to leave government world and kind of jump into the startup chaos, as I like to call it. And then I think like my co-host Leo was kind of in the same boat, right? Like an emergency medicine physician, COVID happens, hospitals were shutting down. Like what are you supposed to do? And so I think naturally, a lot of physicians tried to look at telemedicine as a way to continue practicing and still have their physician identity. But I think there were a lot of stigmas around telemedicine. Like, is it real? Like, I've heard some of the doctors that I work with have told me like their family members were like, "Are you a telemarketer?" And it's like, no, like I'm still a doctor, like still doing stuff. And I think the hardest piece is, when you're working in a hospital or you're working for a massive hospital system, like compliance is set for you. In order for that hospital to run and operate or those clinics to kind of be open, there's a set of like frameworks and accreditations and, lots of checks and balances to be able to kind of get the green light to practice. And when you go into the telemedicine world, it is the wild, wild west. And like, I don't say that to scare physicians. I just say it to like, I'm all about putting the information out there so people understand and can be aware. And so, telemedicine is different in the sense that you have a lot of new startup companies that don't necessarily understand the compliance framework. They don't understand how regulations are. They don't understand just in general, like certain key things that they need to factor in if they're doing Medicaid or Medicare or payer, versus cash pay. There's so many layers to telemedicine that I think like it's really overwhelming for physicians who are trying to make that shift. And again, like you can hire an attorney, but then you're just kind of getting like one little piece of it. And so Leo's actually part of a really amazing physician community that teaches doctors how to, navigate the telemedicine space, how to find roles and how to, do it in a safe way. And Compliance is like one of the top things that they kind of teach in that. And that was how kind of Leo and I connected. Whereas like he is under, he works for all these companies and would kind of come to me and go, does this sound okay? Like I have this one company that's saying it's okay that I don't do, synchronous visits like in this state. Like, is that okay? And I'm like, no, that's not okay. So it's been, a lot of learning back and forth, between him and I. And I think that's also how like I've gotten so involved in the telemedicine space from the physician's lens of you have kind of like a team funneling you all these crazy questions. And me as a researcher, it's been kind of an amazing experience to kind of get them answers that historically, like nobody was willing to provide them.
Makes sense. Again, just from speaking from the practicing physician side of it, usually I think most doctors work, if you're full time, somewhere between 50 to 60 hours per week. And so, this podcast is that you and your co-host do, and one of the purposes of the podcast, the Doctors Making a Difference podcast, is to give people tools so that they can become the best version of themselves. And I think a lot of people in the early stages of the career you do what you're trained to do, and you try to perfect your art. But then sometimes, as a need arises or your circumstances change, it's nice to be able to pivot. And telemedicine is one of those ways that people have been able to dabble a little bit in other areas or expand to a different audience. And yeah, I guess one of the questions I was going to ask you, Phoebe, is so say you're talking to someone, a general family doctor or a ER doctor or someone that's in one of the subspecialties. How would they get started if they say, I want to kind of get into this space a little bit more? What's my first step?
So I think what I always tell people is like and I like to focus a lot on burnout just because I've gotten to experience burnout like personally. And so to me, I always try to say like if you are an emergency medicine doctor burned out from working so many hours, like don't start telemedicine and also think that you're going to be happy doing the same amount of work and the same amount of hours, right? So the biggest thing that I say is like start researching, look at different companies and kind of see like the different ways that you could support in telemedicine. There's so many different subspecialties that, lots of emergency medicine doctors, internists, like we even have like anesthesiologists that are like venturing out and doing telemedicine, which I was like shocked. I did not even realize like how can an anesthesiologist do
I
this?
can't
But
put you to sleep over
I've
the
I've
phone.
witnessed it. Yeah, I'm like, what? How? But I think it's interesting because they're able to go like, well, I am interested in the weight management and the food is medicine kind of philosophy, and I'm going to go get some certifications, and then I'm going to apply to these jobs, and they get them. And so I say like the first thing is like just kind of research and see what's out there. Is there an allergy, company that you might be interested in learning about? Is there, there's so many different things that you could start to explore and maybe just do a little bit of research before, jumping in. I think the next big thing is like one of the key things for telemedicine is, you want to have multiple state licenses. So like that would be the next thing of like kind of just planning on like what are the states that you would want to get licensed in and like is it something that you're willing to actually put the effort and energy into. I think in my experience, I think the one thing I see probably most common is that like you had said, Peter, like doctors are trained like a very rigorous, I think probably since you guys are like 12, like you are just on this
It
path.
attracts a certain personality type, doesn't it?
Well, I mean, yeah, it's like you were on this path, and it's like, well, if I follow this path, like at the very end, I'm going to be this physician. And so a lot of them are like, well, I've been doing this for 20 years. I'm like, I'm not, it's not fulfilling anymore. And so I always try to explain to them, like, you're going to go back into the learning zone. So like it's going to be really uncomfortable and you might not like it and you might think like this isn't for you, but it's like it's that uphill battle of like the practice, practice, practice that I think is what makes them get more comfortable. And so it's like if they're willing to kind of commit to at least 6 months of like, being dedicated to that learning curve, like after that, like it really is like something that they get really comfortable with. So those are kind of like the three main things that I always kind of like say to physicians that are interested.
Oh, fantastic. So first, just to kind of summarize, you would say go look for a place that does it, or look for jobs that are available in that space, and then look at, uh, well, I guess look at the state licensing. Do you recommend most doctors go through the state compact? A lot of our states do participate in that, or do you have them go individually credential state by state?
No, definitely go compact. It saves money, saves time. And like again, like it doesn't necessarily like you don't need to go and get like nationally licensed. Like, pick three other states. I think like a lot of companies are looking for doctors around like the five license, range. And so again, like before jumping all in, it is just something to kind of like, to think about.
Okay. And then the other part you said was just you kind of have to have a long range commitment, or at least 6 months, you said, to just assume that you are a learner, you're a student. In that space, the one question I had for you is who mentors you in that? I guess if there are other doctors doing it, but I'm just thinking like, okay, if I were to venture out and start doing telemedicine, who would teach me? Does the company know what they're talking about? Am I putting myself at legal risk? As my expertise going to transition to this other area? I was curious about that mentorship process.
Yeah, so I think like, kind of to Leo's point, like I don't know if Leo would have been so invested or committed or even held accountable if he didn't have the amazing physician community around him. So I always say like, for example, like, you do want to find those mentors. You do want to kind of like reach out and see like, who else is doing telemedicine. You could join, find a job and, kind of reach out and see kind of the other doctors there and build those connections. There's also just lots of like coaching programs now and master classes. So like I have had the pleasure of getting to like know, one academy, which is called the All in Remote Physician Academy, and they, definitely put coaching and mentorship and really guide people through the process. It's just again like it's a little bit more intensive. But there's other kind of opportunities out there. Like you could go on social media and just type in telemedicine coaching and like you'll find a bunch of people who are probably in that space and are willing to at least have a conversation with you. And then maybe again just like build those connections.
No. Do you have any examples? Again, I don't want to betray anybody's privacy or anybody you've worked with, but in generalities, I'd love to hear if you have any examples of people that have made this transition successfully.
I have more examples than I could even say in probably 2 hours. And I think that's what makes me such a believer in all of this. And it's not, again, like I want to just like preface, like it's not so much that like, oh, telemedicine is this golden ticket, and if you start to do it, you're going to be successful. I think it's that alternative way of like shifting their mind where I can be a physician, I can find a passion, I could, continue to be happy. So I have one physician who he's actually a really good friend of mine. I do consult personally for him now, but for the first 2 years, we were just like really, really good friends. And he was an ER doctor working 300 hours in the ER. I think he was like doing 26 shifts a month.
Holy
Like I didn't
cow.
know what that means. Like I don't speak doctor, right? So
It's
he's
a
like
lot of
26 shifts
shifts.
a month. So I'm like, what does that mean? And he's like, it means a lot. And I'm like, okay. Um, and I think the funny thing was he started to get licensed. He got really into the collaboration side of telemedicine. So he was doing lots of medical directorships, collaborating, oversight. Um, and it was kind of just like he was a natural. He really liked talking to people. He really liked mentoring. And he just closed a multi-million-dollar deal to basically start national clinics, a bunch of clinics actually with a company, um, mainly because they like him as a person and because he's nationally licensed. And again, like he kind of set it up. He really got to control the whole process, but like ultimately, without kind of doing all the pre-work and getting comfortable and doing the small jobs, he would have never landed what I call like the big fish,
Mhm.
which is this, which he's like, oh my God, it's life changing, and so it's like we kind of reminisce on like, oh my gosh, like how far he's come, and now he's here, and it's amazing to see. And I think the funny part about this is deep down his passion is interior design.
Oh, how
So
interesting.
he's so excited because he's like, yeah, he's like, this is going to give me so much time to like focus on my interior decorating. And I'm like, yeah, it is. Like, and like, but again, like to him, it's he's able to reduce his hours. He's going to be making a really great compensation doing something in medicine that he loves and still have time to, focus on his passion, which is, building flower arrangements and painting different walls, different colors, and doing really cool stuff like that. And I think that's the beautiful story behind it.
So was he able to transition into kind of a supervisory role or hiring other people under his direction? I mean, again, one person's not going to pull out a seven-figure income just by seeing patients one at a time. And so it's more kind of creating a vehicle or a tool to reach millions of people.
Correct. Yeah. So in telemedicine, there's a lot of different like regulation packages. So there's a lot of telemedicine companies need to they use mid-levels basically to do like the initial visit or reviewing like asynchronous, through like those the questionnaires. But in order to do it in like about half the states, you actually have to have what's called a collaborating physician or a supervising physician. And so he kind of started in that space a little bit. But there's also another regulation package called corporate practice of medicine, where telemedicine companies are not able to actually own medical practices. And so they look for physicians that can own these practices for them and kind of enter into like a partnership. And so that's what he's doing. He's going to be the practice owner of this national, probably like 100 clinic company that is, focused in, just kind of like expanding access to, different like longevity and functional medicine services. So he's not doing any of the clinical care. It's basically all compliance. So that's why he's working with me to kind of build out that compliance framework, make sure like he's not gonna, accidentally, set the company up in a wrong way. And then from there, monthly, as they expand, he'll make more and more money because of the way that his contract is structured.
Hmm. Another, I want to come back to this supervisory working with nurse practitioners and PAs in just a second here, but I wanted to talk a little bit about scope of telemedicine. My experience is sometimes it's awesome. You get contact with people that really didn't need to come into the office or they didn't need to make the lengthy drive to come out of town to come see somebody or patient. I live in a rural area, so patients don't have to travel just to have somebody review their medications and make sure they've got refills and some of those simple things. On the flip side, I've had patients present with something that was acute, and because, especially during the COVID timeline, we weren't really encouraged to have them come in and see us as in person as physicians during times when it was surging a little bit. And so we had patients presenting with, earaches, or we had one unfortunate patient that had appendicitis and, really kind of missed out on having a hands-on examination. And so that was one thing I wanted to talk a little bit about is how do you discern, how do you make that good decision about who's appropriate for telemedicine and who's not? Because in some ways, it really waters down the physical exam portion of it. On the other hand, it provides tremendous access to people to gain care from wherever they happen to be located. Any comments on that?
Yeah, so I think about it in two kinds of buckets, I guess I can say. The first is that most states, if not all, have kind of blanket statements that basically say if you are going to do telemedicine, you have to provide the same standard of care as an in-person visit. So if you're actually not able to, like if a person goes to a telemedicine visit and it's like a dermatology type, a skin condition, and you're actually not able to even see the thing that like there are certain things where you will need to kind of refer to inpatient care. Um, and the second is there are also regulation packages by states. Let's make it as hard as
Right,
possible.
it's a checkerboard.
Yeah, let's make it really tough for all doctors. That also kind of layers in what you actually can do in telemedicine. So there are certain states that go like if you are going to do, let's say, prescribed weight loss, you have to there's these certain labs that have to be, done beforehand, and you must review these labs with them in a telemedicine visit. And if anything, appears over X number or, certain type of like clinical, thing, you have to refer them to in-person care. So there's a couple different things like that. Now, I've seen, I've seen a couple different tactics with physicians, but I think the one that kind of has always stuck with me with doctors is they're like, I just use common sense. Like if I'm not able to confidently and comfortably diagnose or treat or be able to give them the care that they deserve, like I just straight up refer out because like they are just like I'm not gonna what's the point of playing around with that like thin line when like it's so simple to kind of reject the patient and go, no, no, you need to actually go see somebody else.
No, that makes sense. Um, because I think it does have to come to common sense. And when lawsuits happen, I think a lot of times the jury or the medical review panel look at it from that specific question. What would any reasonable person have done in this situation? So if somebody presents and says, I have acute abdominal pain or I have something that you can't really put your hands on and see, you should facilitate that person going in to receive care. How do most of the doctors you work with partner with in-person care? Are we sending them directly to emergency rooms, or are they partnering with outpatient organizations that, have kind of a partnership with the same insurance network? How do you facilitate that? Because sometimes people really don't have a real clear path, or they don't have a primary care, or they have access to primary care, but it's weeks out, or specialty care is months out. How do you recommend going through that kind of a process?
So most of the telemedicine companies will have like a referral mechanism in place. So they'll kind of handle that process for you. So typically you're not actually having to figure out who to send the person to. You're basically just saying like I'm referring you to inpatient care and then kind of like the telemedicine company like their, provider ops and care team will kind of handle the care coordination piece after that. Um but in terms of like some of the like the telemedicine companies that I've consulted for, a lot of them do. They will have different, kind of like, MOU type contracts where they are able to refer a patient, let's say in like a rural place to a small clinic. And they'll come up with some sort of arrangement, payment arrangement in terms of like how that'll work and how that'll funnel. And I'm actually working on a pretty large project right now in California very similar to that, where they're going to be doing lots of telemedicine work, but they're actually partnering with all these rural clinics to basically say, like, we know that in like a large place, like we could send a person to a hospital, but the problem in these healthcare deserts is not, it's not the like where I live, or there's all these people. It's the healthcare, the rural places that actually need those connections. And so they're actually working right now to really build this like really nice network of rural clinics where they could actually refer patients to.
No, it makes sense. And one thing I've hoped for, again, primary care doctor in a rural area, one of the things that I have found challenging in working with telemedicine is a lot of people the patients will seek telemedicine care through whatever's offered on their portal through their insurance company, or they have an employer-backed telemedicine thing, and they will see a nurse practitioner or a PA for something that seemed like a routine acute thing, and it's fine. They usually get great care, but we basically never get communication about it. And so the person's had their medications changed. Maybe they've had labs ordered. Maybe they've been referred to a specialist without knowledge of primary care. And since I don't really have a recourse to go and say, hey, insurance company X, I need you to send me records from this encounter on this patient. And so it becomes kind of a challenge. And as this gets more developed nationwide and there's more access to it, that's one of the pieces that I hope will happen, is that people will have these coordination networks with primary care doctors and primary care networks, or electronic medical record systems, so that things kind of tie together, so it's a little bit more seamless. Any thoughts on that?
Yeah, yeah, no, totally. I mean, I think so one of the big things when I was a regulator that we were really trying to focus on the policy side was how can we make data sharing better? Because again, like why is it that a patient has to fill out the same information here and then fill out the same information here and fill out the same information here and then the doctor doesn't even have the info, like what is the point of any of this? There's care plans and care plans don't go from primary care to specialty. Like
Right.
yeah, it's a mess. And again, like I can speak like California is where, I was doing a lot of the policy and regulatory work, and we're a very progressive state. Um, and we actually have legislation, it's called the Data Exchange Framework, I think is going live in 2026. But basically, all health plans are required to plug into these data hubs and they're plugging in with EHRs and everything. So it's going to be a seamless data sharing across all the providers. So a person is technically only going to have to, enter the information one time. Care plans will be getting shared. They'll be able to share with even like non-traditional providers. So some of the like community providers on the public health side, like I think it's going to be a huge game changer for doctors, at least in California. And I know they're trying to kind of pilot it. California always loves to like do things first. So, I think the plan is like we're going to pilot it, we're going to get the kinks out, we're going to show kind of like all the other states how we did it, and then hopefully that'll roll out to some of the other states that are also struggling, kind of like you said, Peter, of like, getting the data from these telemedicine companies on, why this thing changed in this soap note and getting like the full history of the patient that you're treating.
Yeah. Well, and I think when I contemplate telemedicine and think back to its history, there was a ability to call people for years. It was just never paid for. And so it's really in the last 5 years that that's become a thing. And so I believe we're still very much in the infancy of this technology. Pretty much, mo I'd say most people nationwide have access to high-speed internet or can get it at a reasonably useful place. Again, I work in a rural area, but even here, most people have access to high-speed internet, even if they have to go to the library or something like that to get it. And so it creates there's a bunch of barriers that would have been in place that are being removed, and some of these regulatory things, like you just described, and the ability to share data, I'm hoping will improve over the next few years because those are, I think that would be inherent no matter what we did. But having this be something that was going to be part of the normal mainstream part of medicine is it's going to be important to make sure that we have all those systems in place so that we don't have like my situation where somebody shows up for their follow-up and like, oh, you changed three of your medicines and got referred to a specialist and I had no idea, and we've been refilling this other medicine and it interacts with the one you were on because you didn't know what you were on when you told the
Mhm.
person, and all these chaotic things that can come just from transfer of information. And most patients don't really understand interactions between medicines, especially if they're medically complex. And so I applaud the efforts. I hope that it will work in the state of California. I'm always skeptical on that kind of stuff, but I hope it will work.
Fingers crossed. I mean, like I think the biggest thing for me is like you try, you fail, you pivot, you learn, and then it gets better, right? And
That's the
so
hope.
that's the hope, right? And so, to me, I think this has been something I think that the state has been working on since 2019. So it's been like there's been tons of planning in going into it. And again, like mainly it is to again kind of connect some of the, the Medicaid world with like the outside world of like, the commercial payers and some of those things. And so fingers crossed, fingers crossed. I have faith in my policy people.
Let's hope it works. Yeah. Well, another piece of this that, again, I believe has come on primarily just since COVID during these last 5 years is, again, you prior to this, you could always call somebody. You could set up a video chat. There was just no payment method for it. Now, most insurance systems and Medicare, Medicaid have recognized the value of this, and I've found that my patients love it, especially when we're referring them out because it's an hour and a half drive to the nearest specialty center from where I live. So if I send somebody to a specialist, it's all day to drive and all day to come back. And unfortunately, a common experience is I drove all day, I took a day off of work, I went over there and I saw somebody, and I didn't get to see the doctor. I saw a PA and they simply renewed my medications. And I drove all that way for that. And it would have been perfectly appropriate to have that conversation over the telemedicine to begin the process or order the labs or make a tweak on the medications or something. And then leading up to the time when I'm going to have my procedure or I'm going to see the actual specialist to where I was referred. And so I'm pleased that insurances have started to pay for it. And I guess the root of my question with all this is where do you see that going? Like there's all this threat, nationally about how much we're going to cut back and how much we're going to pay for, and our insurance companies kind of reflect what CMS does. What are how do people get paid for what they do in telemedicine? Maybe walk us through that a little bit.
Yeah, so I think there's a couple different methods. And so I think there's a couple different buckets that I like to like focus on. So You have a good chunk of companies that are really focused on the Medicaid and Medicare population. Um, and I like, just like you, Peter, like that is the population, in my opinion, that needs the telemedicine the most, right? I have a bleeding heart for Medicaid because I grew up in the Medicaid world, right? I did it for 10 years and I did it because I believe I believe that they deserve the same access as like you and I would have, by
Absolutely.
going to,
100%.
our commercial insurance. And I feel like it's the population that we have forced to go through every single hoop and hurdle and make as complicated as possible because of regulatory things and bad policy decisions. And so like one of the reasons why like to your point, like why force a person to go to a in clinic visit if you can easily treat and diagnose and have a conversation through telemedicine? And so, Congress just extended the telemedicine waiver through September. It was actually going to expire at the end of this month. They were already messaging patients saying like you have to go back in clinic if you have and patients are like, I've been waiting 4 months for this appointment and now I have to go. So great news that that was just, extended. And I think that it's going to keep going. I think that policymakers are probably behind the scenes looking to, pass some bills and really try to make it a little bit more of a permanent shift. It just takes so much time. Like unless you've done like actually tried to pass a new regulation or a bill, you don't really know that it takes like years to do.
Oh,
And
it's a
everybody on the
huge process.
outside,
Huge
well, everyone on
process.
the outside is like, just do like what is so difficult? And like me as like somebody who's done both sides, I'm like, believe me, like I spent 3 years trying to define the term significant. And then it stayed the same. So, like there are those little things that are like, so I think that on the Medicaid and Medicare space, like that's really where I think a lot of companies are going. And I think they're really trying to do great work and really expanding what is currently there. The second, piece is like your traditional like commercial market. So you have like your like kind of like Teledoc and like some of those where you're just kind of, supplementing the in-person care for a lot of like the commercial payers today and some of the clinics. And again, both of those I think have a lot more red tape in my opinion, because anything you do with billing is an auditor like myself, the first thing you look at is like, what are the claims and like where's the money going? And if it doesn't add up, we're gonna go investigate and we're gonna pick three physicians to come down hard on, even though there was probably hundreds. And that's where you start to see some of those issues. So those anyone who's working in that kind of world, I always say like ask a few more questions. What are your billing protocols? Can I see your compliance plan? Can I talk to your compliance officer? Little things like that just to kind of make you feel a little bit more comfortable. And then on the flip side, there's like a really huge telemedicine cash pay market, which I think is the market that I'm a little bit more interested in terms of I think they're doing really cool and innovative stuff. Women's health services, functional medicine services, food is medicine, health coaching, weight loss the right way, which I say is like, yes, you can kind of do the weight loss drugs, but they're also giving you, food and nutrition support and giving you a dedicated health coach and really like holding you accountable to do some of the things like the lifestyle changes that you need to be successful. And so I think like on the cash pay side, it's really cool because like there's a lot of things that I would never in a million years think of as being like a possible telemedicine company. And then it's like, oh, that's great. Like Leo actually works for a company called Summer Health that is for new parents. And it's basically like there's doctors that you text with that if your kid has a fever, you have a 2-month-old and he has a fever, what do you do? And it's 3 in the morning. You text
So,
Leo
you're
and
like talking about like my practice. I'm rural, so everybody texts, calls, or comes to my house or catches me at church. So it's
is
like
like
having a rural doctor in your pocket at all times.
exactly. Well, I think it's not just it's peace of mind.
Right.
Like I go like I'm so blessed because I have this amazing group of like 300 doctors that if I something pops up on my skin, I'm like, all right, I'm gonna talk to my allergist and my dermatologist friends. If I thought my son broke his nose the other week and I called an emergency medicine doctor and he's like, don't go to the ER. Like, go tomorrow if the eyes are black. I mean, again, like so many of us are making these health decisions from a patient's perspective, and we don't know. Like I'm not a physician, but we also don't want to make a mistake and not go to the doctor if it really is an emergency. And I think building these tools where people can have like again, not, just like I always say, like I don't provide legal advice, like not actually even like medical advice, but just somebody to be like, am I doing this right? Am I thinking about this right? And I think for new parents, like summer health, like when I had my first child, it was scary. I mean, I think I was at Kaiser like once a week, So, I think like these things, these telemedicine companies are really trying to fill some of those voids that our traditional healthcare system has unfortunately created.
Right. Well, and it's kind of nice because especially if you're on a kind of subscription service or something like that, you're not paying a huge fee every time. And yeah, it's one of the challenges. I think this will be a means for changing on some of the like per patient per counter and billing per
Yeah.
encounter billing that we encourage that we see. And I remember when I first started, especially, I grew up in this small town, and then I came back as a physician, and then I'd have patients come in and say, "Hey, Dr. Crane, I've got a bill here for $150. All you did was blah 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 blah." And they don't see the back end of it, that there's all this work and regulatory stuff, and there's a ton that goes into every patient encounter. But if you do it on a on like a subscription basis, or you have a what's kind of a more reasonable fee for something where you just get simple advice, I could see it being a huge benefit for patients for sure.
Yeah. I mean, I go back to like, and again, maybe it's a generational thing. Like I have a podcast coming out where like my mom has never done a telemedicine visit. And she's like, I don't understand. Like, she grew up going to the doctor. And so for her, like that's her comfort zone. I grew up in a different generation where like if I don't have to leave my house, like I don't want to leave my house. And so to me, again, I think it just, I'm really passionate about meeting people where they are. I'm not saying you have to have telemedicine, but I'm also saying like in-person care is not 100% the alternative either, right? I think that people should be able to be treated in the way that they need to. I did a really large project during COVID with public health, and we got to build, not build, but we got to work with all these different community organizations and kind of turn them into these like mini like community clinics. And it was so beautiful to see how many more people were willing to go to these community clinics and get care because they trusted those communities. They knew those people. They were churches, they were community centers, they were food banks. But they're like, oh, but I know the pastor at this church. I trust him. And so like, yeah, I'll go get a COVID test or an HIV test. And it was really, to me, it was like the first time where I kind of got to experience this, like, oh, like this is what like Medicare for all would look like. And like, how many more people were able to get the access that they need because there weren't the barriers there. And they got to, kind of pick like how they wanted it. Which again, I think is like ultimately from a consumer and a patient perspective is like I think all we're asking for from doctors.
Yeah, having the ability to meet people where they're at, I think, is an important principle that should thread through most of the things that we're doing. I always tell patients the best care you'll receive is the care that you will receive. Sometimes
Yeah.
people they need a service, or they need a preventative care, or they need a specialist, and I think that's an important principle, because I can recommend you the best thing ever, but if you're not going to do it, I'm just wasting my breath. But if I meet you where you're at, and I say, well, let's start here, or let's get this test and we'll go so far and see where you're at, then people are able to get what they need. But I do think that telemedicine fills that space, or serves that need a lot. So I'm glad that it's coming online. I'm interested to see all the improvements that can happen on it. And I'm interested to see how physicians with experience can get involved in it, like you've talked about, Phoebe.
Yeah, and I think too, like the way that I view it, and I think this is probably why like I'm so passionate about the space, is like I think it benefits, it definitely benefits patients and it benefits access, it increases access. But it just also benefits physicians. Like I've gotten to really see how many physicians have, changed their lives really. And I think it's, before doing this, like my dad made a funny comment. I was saying like how like I was, talking to a couple doctors, and it was like really sad. Like I had one that he was really depressed, just like very, very depressed, so burnt out. Um, and I was, talking to my dad a little bit about it. And he's like, "Oh, but he's a doctor, like he'll be fine." And I'm like, "But like, why are you putting a stick like that to me is the problem with all of this. Like we're assuming like, oh, you're a doctor, you became a doctor, like everything's okay. Like you're good. You did your training, you did your residency, you made your choices, you're stuck." And I'm like, I think like telemedicine is a means to kind of end some of that, And so I just think it's really great to see some of these doctors do some of these things that they didn't even think were possible, or try and, learn a different technique or try a different specialty. There's so many that are getting really involved in the aesthetic space or the mental health space or ketamine therapy as like alternative therapies. And they're actually kind of figuring out what they're more interested in, doing their research, and then from there seeing where they could fit in and actually support these companies. And I think that to me, like that's the solution to burnout. It's not, it's finding passion again in something that you kind of have to do, and you're going to make some money from it, but really finding that passion and that spark again.
Well, and finding a way to stay involved in medicine
Hmm.
without working the number of hours and some of the crazy work circumstances that people get involved in. And so,
Yeah.
I mean, it sometimes is just crazy, and it is a wonderful opportunity for people to pivot a little bit. If you feel stuck, there are especially over the last 5 years, there are a lot of jobs and a lot of opportunities where you can do something maybe within your field, maybe adjacent to your field, or maybe something totally unrelated if you're willing to go back and get training. Um,
Yeah.
you
Yeah.
know,
And also too, like I, over the past, I don't know, 5 months or so, mainly because I work with so many physicians, I have been building a physician marketplace where they can kind of find some of these opportunities. So different like leadership roles and the collaborating physician opportunities. And it has been really interesting to see, because if you put it in the hands of the physicians of like just work on the opportunities that you want, it's really interesting to kind of see again, like the little bit of spark that the physicians are having where they're learning some of this. I'm guiding them on how to do it in the most compliant and the best way, basically. But it also is kind of taking that like, you know, see one, teach one, do one kind of mentality back. And they're kind of they're in that like, they're teaching again and they're mentoring. And I think that's also been just really beautiful to see like there's so many different things that they can do. It doesn't mean that you have to sit behind a computer screen and like review, a bunch of cases that are coming. It doesn't mean that you have to sit and do like live consults. There's so many opportunities out there. I think it's just really important for a physician to be like, what is that? What excites me about medicine today? And I promise you, like, if you don't know, like, let's talk because I could totally tell you what you can do that's going to make you happy in that very niche field. There's so many opportunities. And again, like I just wish more physicians knew about it.
well, doctors are passionate people. So you're right. If you reignite that passion, it's amazing what they can do because it's such a long road and such a competitive field to get into. And people start with this intense drive to do good and do right and help patients. And then you can get yourself really burned out when you realize you lose control of you lose autonomy and you
Hmm.
kind of get into this space where everything's hyper regulated and and sometimes you're asked to work beyond what a reasonable number of hours. I wanted to reflect back on what your dad said. I think that's pretty common. Like, oh, but so and so's a doctor. They shouldn't have problems. And that's a kind of a horrible social stigma. I mean, we're just people, and you have to be able to you have to live like every mortal person, and you can't just be like some robotic person going on again and again and again. After a while, you're not really behaving in a way that a human being should behave. And so I hope that this can be a means to help for a lot of people who find themselves in that super burnout zone.
No, absolutely, absolutely. I'm a big believer in like, yeah, we are all humans. I think that we were put on this earth to try things and to be naturally gravitated to different things that we're passionate about and to get better at those things, right? Like I tell my kids every day, like practice makes perfect. And then like I whisper, I was like, but perfect doesn't exist. So like keep practicing.
Right.
But like that doesn't work if you're practicing on something that you're not passionate about, right? Like if you gave me a bunch of accounting books, like I'm not gonna go and read those books and read those books and read those books, right? Like before this, Peter, like I sat down, I think I spent, I don't know, 8 hours. I listened to a bunch of your older podcasts. I do research. I look into regulations. I love this. And to me, that's why like you can't get burnt out if it's something that you really are passionate about. And I hope that more physicians can get out of the ER and get out of doing the things that they feel like they're trapped doing and really, find the ability to have a little bit of a growth mindset, be open to kind of challenging themselves, jumping into trying something new, and who knows, like become an interior decorator doctor. I don't know.
That was a great story. Yeah, no, speaking of which, I just came off an ER shift, so if I look a little bit tired, I'm like just coming in and trying to stay awake during all the next day type stuff. But um
Yeah.
I want to talk a little bit for a second, Phoebe, about you alluded before about working with uh mid-levels or if you want to advanced practice providers, PAs, nurse practitioners, whatever the appropriate term is that people want to be called. But how is it that you would recommend doctors get involved in that? And specifically in the telemedicine space, I think there's a lot of opportunity for mentorship and teaching and facilitating. I'd like to hear more about your thoughts on that.
Yeah, so I think that there are a couple different ways. I always say like you can partner with a bunch of companies. So that's kind of how I got into this. A lot of doctors were interested in being a supervising physician. And I think like they've probably heard through word of mouth like it's an easy way to make money. And I talk to a lot of like practitioners. So besides physicians, I work with tons of nurses and physician assistants. Um, Mainly on, like how to do this in the right way. And I go back to, I've had amazing mentors like my whole career. Like I think one of the reasons why like I'm so young and I've been able to accomplish so much is because I've had the right mentors at like the right time. Like 25, like I'm getting te like taught by the top policymakers in California. Like doesn't exist, right? Like, so I think that collaboration is supposed to be a mentorship tool. It's not supposed to be oh, I'm going to check the compliance checkbox. I'm going to take my $800 a month and walk away. Like, you're supposed to spend time with that person. You're supposed to mentor them. You're supposed to make them better. Because at the end of the day, like they are expanding access. They are an extension of a physician. And I think that there's a couple ways that, to kind of get started. Like you could work with a company. So like my company's name is Single Aim. It's a marketplace. You could work with us. The big thing I focus on is like the physician gets to control the process. So like we train you and we guide you and we kind of help you, figure out how to go about it. In a compliant way. And I also tell doctors like what not to do. Like don't do that state or don't do this state or whatnot. Because so many other companies that are out there will kind of just be like, sign the document. They're not really going to tell you. Whereas like I'm really big on the transparency side. Um, and that kind of goes for like medical directorships and PC ownerships. Like I think the biggest thing is just like getting started and not being afraid and being open to kind of learn this new mentality. But you think about it in terms of like you're a mentor. And if that's something that you want, you're a mentor, you're a coach. Like if you are interested in that, then like you will be a great collaborator. And if you're not, like if it's just like for the money, then it goes back to my whole burnout thing of like maybe you probably shouldn't do it because you're not going to do it very well.
No, that's wonderful. And I think you're right. A lot of people have this craving, this desire to teach. We were taught, I feel like I was taught by wonderful mentors, and the opportunity to give back and teach is a great thing. Sometimes we do it with medical students. I feel like maybe that's getting better, but I felt like in my training, there just wasn't a lot of opportunity to collaborate with advanced practice providers. And so I never received formal training on how to do it. And I think a lot of doctors will tell me the same thing when I ask them. They say, well, I don't really know what the capabilities of the advanced practice providers are, or I'm not sure what their training is. And so people, I think a lot of physicians come at it from not necessarily from a desire to not help, but simply just not knowing where to start, or what do they know when they come out of school, or what's the regulatory requirements of how I teach them. And so kind of back, like I asked you at the beginning on the telemedicine, how do you recommend somebody get started if they say, I want to be a collaborator, I want to help make it so our advanced practice providers have more training or have access to information and don't feel like I want them to feel facilitated so they can ask questions and get mentored properly.
Yeah, no, absolutely. So, I my philosophy on this is exactly what I tell all the physicians, right? To be a mentor, you kind of need to know what you're doing, and you kind of want to make sure that if the person that you're mentoring has a question that you're not freaked out and you don't know the answer, right? So like if you're an emergency medicine doctor supervising a mental health practitioner, but you've never done mental health, like to me, like I wouldn't want to put myself in like that's going to give me anxiety. You know? So I always say the first thing is like look for the opportunities where you actually feel prepared to support that person. You know, maybe you are really passionate about mental health and you could kind of get the additional training and you know all of that. Prior to from my company, prior to, you know, finalizing an agreement or going, yes, we want to meet, or yes, we want to collaborate. I say that you're supposed to meet, you're supposed to talk, you're supposed to, you know, ask them questions like, what do you like their experience? Do you feel comfortable in how they want to do things? Do you jive? Like, do you actually want to mentor that person? Like, do you like them as a practitioner? And then vice versa. Like, I tell my practitioners the same exact thing. Like, did you get the warm and fuzzies from the doctor, or like was it not there? Like let's keep working to find you the right doctor that you want to collaborate with. Because to me, I think that this is something that could be so beautiful if done correctly. And it's just unfortunately the way that this market is it's been all about money and like the regulations. And I think it's so much beyond that. So,
Yeah.
you know, I think rule of thumb is like, yeah, meet with them, see if you're comfortable about it or, you know, comfortable with their experience. All physicians that work with my company, I have like 200 unread text messages right now of like should I do this? Should I do this? This person says this. What do you think? We host like these weekly sessions and we just brainstorm and talk about it and they raise their questions and I give them, you know, my thoughts. They get to hear from other doctors on how other doctors kind of assess that. And then they kind of go from there. But my biggest thing is like, how does it make, like, are you going to be able to sleep at night knowing you are supervising an NP or a PA that is doing those things? And if the answer is yes, fine. If the answer is like you're on the fence or no, I don't think it's the right opportunity for you.
Hmm. A related question, how many states, or maybe you don't know this, but what percentage of states would you say require a collaborative relationship like that? Because I know I'm in Idaho and I know it's not clearly defined in Idaho, and I was curious how that goes across the spectrum in our country.
Yeah, I should know this off the top of my head, right? It's around the 20-ish number range, right? So like, you know, I could say like our top states or and they're big states, California, Texas, Florida, Ohio, Pennsylvania, New York. Those are, you know, those states require collaborations. And those are the ones that we are seeing just a huge influx of practitioners that are, again, I think most people don't realize like the majority of California is rural. You know, like I live in Northern California where it's not, but like, you know, 70% of California is very rural. And so, you know, a lot of practitioners are just trying to kind of, again, you know, fill those voids and be able to kind of like see patients so they don't have to drive, you know, 2 hours to the nearest, you know, clinic. Um, so those are like some of the top states. Now, each state does have their own weird quirks about them, and some require in-person, you know, meetings twice a year, or some require this other hurdle. And I think all those complexities kind of factor into like whether you want to do the opportunity and then how you're going to price that, you know, that collaboration.
Well, that's really good information. Phoebe, I feel like my mind is just like dazzled with all these pieces of information that you've given us. And I think our audience will find much the same because whether you're ready to take this on now or at a future chapter, or if you just want to roll telemedicine into your normal practice, all this stuff is relevant. And again, Telemedicine Talks is the name of our sister podcast on the Doctor Podcast Network. And so I'd refer you there. But Phoebe, I wanted to ask if you have any other thoughts or final parting advice for our audience, because I think this has been very fascinating and instructive for our audience.
I think the biggest thing is I think there's a really big misconception that if you want to try telemedicine, like you have to pick. You don't have to pick brick and mortar or telemedicine. I think it's a way for physicians to, again, maybe reduce some of that in-person clinic time. And again, really start to explore like other types of medicine that they could find, interest in. And, I think my biggest parting thought is like, to me, the only solution to the healthcare issue and the state of healthcare as it is today is physicians. And we need more physicians that are willing to try different things and to push boundaries and to be innovative and to lead these telemedicine companies and not the tech bros. And like we need more physicians to kind of like raise their hand and go like, I'm willing to step into this and I want to take the challenge. And I know there's going to be a learning curve, but like I know that for the greater good, like I'm going to do it. And I think that, if you have the right mindset, it's a great way where you could actually make meaningful change. I don't think you'll be able to change different payer things and how commercial insurance operates today. And I believe like that is one of the reasons we've all kind of said screw the traditional system and like why so many people just want to, do concierge medicine and cash pay. And I think again, like having physicians kind of lead at the forefront of some of this innovation and take it by the horns, I think could be really, really game changer, like a huge game changer, not just for physician burnout and for, even just like money purposes and finding, alternate streams of income, but for patients, for the consumer, for all the access issues that are just so prevalent today. Like to me, like that is really where like physicians, this is the space where like physicians really could make a huge change.
It's wonderful, Phoebe. I love it, this call to action. Be the change you want to be. And if we're not led by physicians in healthcare, who are we led by? And if it's not physicians, if it's not people who've done the training, we're being led by people who are outside of that realm. And then instead of complaining all of us do and saying like all these rules don't make sense, we have some end user that's making a rule that really is not helpful for patients. We have to get involved and stay involved. And this new area, telemedicine, I'm sure we're still kind of in the infancy stage, and I think it will continue to grow. And Phoebe, this has been excellent. I really appreciate you taking the time to do it, and I hope you have a wonderful day. And I look forward to connecting in the future.
Yeah, thanks so much, Peter.
Yeah, you have a wonderful day. Thank you so
Yeah. All
much.
right. Talk soon.
Thanks. Bye
Bye.
bye. Thanks for tuning into the Doctors Making a Difference podcast. And thank you for what you do to help your patients and your community. Your work truly helps so many people. We produce this content to help you have the tools you need to stay in medicine and to highlight the amazing work being done by physicians around the world. Please note that while I am a physician, and many of the guests on this program are also physicians or other professionals, the discussions on this podcast do not represent my employer or any professional organizations to which I belong. This podcast is for your information and entertainment only, and should not be taken as professional advice. You should seek appropriate professional advice pertaining to your own situation. Please check out more of our content on our website, doctorsmakingadifference.com. Also, please follow, like, or subscribe on your podcast player or YouTube channel, and give us a 5-star rating. It really helps to spread the message. Finally, if you'd like to be a guest on the podcast, or if you'd like to nominate someone else to be a guest, please visit the website or email admin@doctorsmakingadifference.com. See you next time.